Heavy loads in school backpacks can not only be uncomfortable for students of all ages, but particularly in children, it can cause lasting health issues. Dr. Ben Escott is a pediatric orthopedic surgeon at Children's Hospital of Wisconsin. Doctor, I bet you, a lot of parents would hear that and say, heavy backpacks. My kid can handle it, big deal. But there are some serious issues if they're constantly carrying these big, heavy backpacks.
No, absolutely. Backpacks are a source of back pain in kids that come into our clinic every day. Backpack is very common, so a lot of parents will brush it off and say, oh, there's not much to worry about. There are some things you can do as a parent, as a child, to lessen the load and lessen the strain on your back.
What sort of guidelines are we looking at? I mean, how heavy is a backpack that's too heavy?
So the American Academy of Pediatrics put out some guidelines that said a backpack probably shouldn't exceed 10 to 15% of a child's body weight. And that doesn't mean you need to get a scale and weigh it, but if you look at your child when they're putting their backpack on in the morning and they're really struggling to get it up there, probably means it's a little bit too heavy and you can make some changes.
So what do you recommend to parents? I mean, the kids have to take to school what they got to take to school. So what are some options that you recommend?
Yeah, kids have a lot of books they need to get to and fro. Some things we'll recommend: always use 2 straps on your backpack. Helps distribute the load. If they have a waist strap, that can help distribute that weight even better. Only take what you need. So if you can leave some books at school or leave books in your locker between classes, that can help lessen the load as you carry your books around every day.
Boy, they're not good at that either. Everything comes home in the backpack.
That it does.
Back and forth,
it does.
Right? Let's talk about when you have children who may be developing some serious health issues because of maybe a repeated carrying of a heavy backpack. What are the warning signs that parents look for when they shouldn't be dealing with it themselves anymore and they need to call you?
So in general, a child who's been complaining of back pain for 2 or 3 months should probably be checked out. A child who's complaining of some other associated symptoms, not just back pain, but perhaps numbness or tingling in the legs or weakness in the legs, can be a sign something else more serious is going on and should be checked out by a pediatrician.
I imagine as quickly as children can experience some of these health issues, because they're children, if they begin working with you, you do in rehab and other things, they can bounce back pretty quickly as well.
They can indeed, and if a child is having a lot of chronic back pains due to some overworking or muscle strain, they can benefit really greatly from some physical therapy. We've referred them for that, and it tends to do quite well at helping with their back pain.
All right, good message, Doctor. Good to see you. Thanks so much. And
Pleasure.
If you have any interest in more information on this or any of our discussions that we have every other week with Children's Hospital of Wisconsin, we've set up an easy link for you at tmj4.com.